Hello, dear friends. My name is Sofya Dorinskaya. I am a doctor and the head of the Center for Medical Information. I will continue answering your questions. And honestly, I don't really like or approve of comments like use your head and so on. But in this case, it's hard not to agree with the person that you need to use your head. Although, of course, for your head to think, it needs to have information, whereas in this case, it wasn't the head that was thinking. All right. So, the comment is, Nicotinic aggravates arthritis, in all caps with 3 exclamation marks. I got a fever of 39 and terrible joint pain. After the 3rd intravenous with nicotinic acid, I ended up in rheumatology. They barely managed to save me with more intravenous S, and they prescribed prednisone for 6 months. Well, and after that, just use your head. All right, let's join the author's slogan, and let's think for ourselves. So, nicotinic acid. No, that's not where I'll start. I want to say that the body can't cope with chronic inflammation outside of flare-ups. If you don't know, there's a rather nasty disease called gonorrhea. It's a venereal disease, and gonorrhea can be chronic. A person is basically a carrier. Their gonorrhea doesn't really bother them, or just a little. But of course, they still infect their sexual partners. And venereologists, they figure out who has been with whom. There, as is often the case, they find those patients with chronic gonorrhea and admit them to the hospital. And if that gonorrhea is not in the acute stage, then first these people are given a special medication regimen to bring the gonorrhea into the acute stage. I want to note that this is an unpleasant condition. It involves burning sensations during urination, pelvic pain, fever, pus discharge. It's just awful. It can also lead to infection of the bladder if the immune system is weakened. Overall, it's a nasty condition. Of course, when this is done by doctors in a hospital, they follow up with a strong course of antibiotics and so on and so on. But you need to know this principle. After all, doctors bring gonorrhea to the acute stage not because they just feel like it. They would be happy if the body could cope with the inflammation in the non-acute stage. Someone feels nothing, takes antibiotics, still feels nothing, then recovers. It doesn't work that way. Now let's figure out what happened to this person. What is arthritis? Arthritis is a chronic inflammation of the joints. What is inflammation? There's an infection there. There's some kind of infection that got in from somewhere. There's inflammation here. What doesn't hurt when you have arthritis? This is inflammation between flare-ups. But that doesn't mean there's no problem here. What happens when a person starts taking nicotinic acid? I want to make a separate note. Vitamins are not medicines. Vitamins are nutrients. And what does that mean? It means that the body was given nutrition. It actually consumed the necessary substance, and it gained strength. To detect chronic inflammation, bring it to an acute stage so that it can be dealt with. I see, it's a chain. The body received a nutrient, detected chronic inflammation, and turned it into an acute stage. Because now it has the strength to deal with it. And what you did to your body after that is the foolishness of all the teachers and participants in the process. You developed a fever of 39 and had severe pain in your joint. Finally, this inflammation, this chronic situation, turned into an acute stage. A normal doctor who understood what was happening to you would have prescribed antibiotics and would have stopped giving you nicotinic acid, because that's just nonsense. Because if the doctor is knowledgeable, he knows that the best way to absorb nutrients is always through the mouth. If a person has a swallowing reflex, there's no need to give them anything intravenously, or if they're in an adequate mental state where they can swallow. Yes, because it's clear that when a person is in a severe mental state and needs to be fed, you give them nutrients through a tube which goes into the stomach, not through an intravenous. Why? Because the best absorption of nutrients is always through the mouth. It's the most effective way. Because vitamins need to be activated in the liver after passing through the wall of the gastrointestinal tract, through the circulatory system. They enter the liver, get activated, bind with the necessary proteins, and only then do they start to work. When you bypass the gastrointestinal tract, well, basically, some of the vitamin delivery methods aren't quite right. That's why intravenous administration of vitamins is justified. It is possible, but it's considered a medical procedure. Because before you started administering them intravenously, when you take them with food, it's just food, it's nutrients. And only in this way, if you are able to swallow, vitamins should always be taken orally and never administered intravenously. So that's what smart doctors should have done. If your temperature has reached 39, can you imagine what chronic inflammations your body has detected here? And what is a fever? It started dealing with them. All right, you should have been prescribed antibiotics, because most likely there is some serious bacterial agent here if you have such a high fever. You should have been provided with a quality meat-based diet. And I'll continue. In this video, the next question is about this. You should have been prescribed high doses of vitamin C because of the inflammation and high fever. We know that vitamin C is always used up. You should have been prescribed vitamins, because we always know that vitamins also help reduce inflammation and increase the bactericidal properties of the blood. In general, they should have handled your case properly. I'll tell you more. After you went through this episode, your inflammation would have started to subside, and then all of this would have stopped. But you went and destroyed what your body was trying to resolve. You started taking prednisone for another 6 months, which means you also wrecked your immune system, which was working perfectly well. Well, I have no idea how you're going to get out of that situation now. That's why I support the call to use your head in this situation. Also, with rheumatoid arthritis, there's an exacerbation when consuming animal protein. It's easier when you don't eat meat. It's easier when you don't eat. Usually, I've already mentioned this. You can only stop eating in one place, the cemetery after you're buried. It's absolutely the same situation. We have chronic inflammation. We have ongoing inflammation, not acute. Then you start eating meat. The body starts producing immune cells, immune proteins, and the body gains the strength to recognize this inflammation, and it starts to aggravate it. But I always tell you, there is no pill. There is no single solution that will bring you unearthly happiness. The solution is complex and multifaceted. Vitamins don't work without meat. Meat without vitamins is a better situation because meat covers more of the body's needs, so to speak. Vitamin deficiencies aren't good either. And if you want to solve the problem, you need to eat enough meat, which provides the body with nutrients. And you need to take vitamins and eliminate vitamin deficiencies and make sure they don't appear. And only with this combination do you get a complex that keeps your body in a healthy state. So, what happened in this case? The body gained the strength to detect the inflammation, to aggravate it in order to deal with it. And getting scared, not understanding what's happening. Because of a lack of knowledge, a person's normal process was simply disrupted. It's clear that you need to know how to guide a person in such a state, and you even need to explain to the person what's happening. If the temperature is 39, antibiotics should have been prescribed. For some reason, they kept the person on prednisone for 6 months, which is extremely foolish. Well, as for how you're going to deal with this, I really don't know. Basically, you just wrecked the person's body, that's all. So I'll join the author of the comments. Use your head. All the best. Goodbye.